Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about PCOS and its very rare connection, which is nothing but PCOS and its connection to hypertension. So what is hypertension? Hypertension is nothing but high blood pressure. In medical terms, it is called as hypertension. So today in this topic, we are going to discuss how PCOS on a longer run can cause hypertension and that can cause cardiac diseases. And not only that, how PCOS can maintain this hypertension, and what pathological things are running inside the body, what are the changes that are happening inside the body because of PCOS and because of hypertension, and is it something to worry? We are going to discuss all about this and also the best treatment options for PCOS and hypertension. So if we are explaining like this, it would not be, very easy to understand the topic. If we have a pictorial representation, it would be very easy to understand the topic and also to remember it. So let's explain this topic through screen so that you can have better understanding. So let's dive into the topic. Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about PCOS and HTN, or we can also call it as hypertension in medical terms. In normal language or normal vocabulary, we call it as high blood pressure. So let us see how PCOS affects this high blood pressure, causes it or maintains it. What is hypertension? Hypertension is also known as high blood pressure. It is a medical condition where the force of the blood against the artery wall is consistently too high. So I think there is a lot of medical terminology. So let me break down to you so that you can understand what is blood pressure and what is high blood pressure and what is low blood pressure and how is this blood pressure causing or how do you measure it. So as you can see, this is the heart, right? So whatever vessels which come from the heart, okay, vessels which are coming from the heart are known as arteries, and vessels which are going to the heart, okay, they are going to the heart are called as veins. Arteries take blood from the heart and supply it to the organs, or as we can say body, and from the tissues again it gets back to the veins and the veins take it to the heart. This is the normal blood circulation that happens inside our body. Okay, the heart pumps blood, right? Whenever the pumped blood is hitting the wall of the artery, the pressure with which or the force with which the blood is hitting the artery wall is called as blood pressure, right? Then we have two kinds of major conditions in blood pressure, which is called as high blood pressure or HTN and low blood pressure. Okay, so what happens today? We are going to only discuss about high blood pressure. So how do you know if you're suffering from high blood pressure? For example, if you're a person who is aged at around 30 years old or 40 years old and your blood pressure while being monitored is consistently, that is consistently for a week after being monitored, it between different times of the day, your blood pressure is consistently high. What do you mean by high? It is more than the average. What is the average? The average is 120 by 80, right? You can plus or minus 10 in this one, that is it can be 70 also. This you can plus or add minus or add 10, like it can be 130 or it can be even 110. Not it will not make much of a problem. But when your blood pressure is 140 or 150, it is more than 140 and consistently the lower one, this upper one is called as systole, the lower one is called as diastole. Okay, the systole, if it is raising to a little bit 10 or 20, we can manage it. But if the diastole is rising, then that is something that you have to be worried. If the diastole is more than 85, that is it is hitting 90 or more than 90. If the consistent blood pressure is 140 to 150 with the diastole with 90 or more, then that is called as hypertension. More than 140 by 90 mm of Hg consistently for a week, then that you count it as hypertension. What if you are aged around 60? This calculation is for 30, right? What if you are aged around 60 or 70? What if you are aged around 55? Is this the normal blood pressure? Then see, whenever you are counting blood pressure, if you are under the age of 50, then 120 by 80, right? But if you're measuring it after 50 years old, then as I told you, blood pressure is by two things, which is the systole and the diastole. Diastole at any age cannot be more than 85. Okay, given time at any age cannot be more than 85 or 90. But if it is hitting 90, then that means you are hypertensive. But systole, there is a change, there is a calculation. What is it? If you are after 50, then 90 plus your age. If you are 50, then 140 by 80 is normal, right? If you are aged around 80, then 90 plus 80, which is 170 by 80 or 70 is considered a little normal, or it can be normal. Why? Because your systole will increase with your age after 50, but the diastole should not be increasing, right? So this is the whole calculation of blood pressure. So if your blood pressure is more than your age, for example, if you're 50 years old and your blood pressure is at around 150 and the diastole is 90 or 85, you are hypertensive in nature. This is a very simple calculation, but remember, when you're measuring blood pressure, there are two things to be noted. One is the activity. For example, if you have done some activity or coming and measuring your blood pressure, it will not be the normal blood pressure that you're experiencing. Second thing, if you're anxious or if you're stressed out about something and you're measuring your blood pressure, then that will also not count for your normal blood pressure. And the third thing that you have to understand, lying down and checking your BP is considered right. And the fourth thing that you have to understand is that measuring with the mercury sphygmomanometer will give you a proper reading rather than measuring it with an electronic device. If the company is really nice, or if the company has undergone certain trials properly, then you should understand plus or minus 5 changes can happen. But if you are using a company which does not have proper clinical trials on its device, then the blood pressure difference can be up to 10 to 20 in some electronic devices. So I would advise you to check it with the mercury sphygmomanometer. And there are different ways of measuring blood pressure also, but the common way is using a stethoscope and checking the pulse of the person by where the cuff of the BP machine is tied and is inflated, right? Next, we will go into what are the symptoms of the hypertension or high blood pressure. Now coming into the signs and symptoms of high blood pressure. The first one is having severe headaches. Remember, if you are having headaches, especially in the occipital region, see, headaches can occur anywhere in the head. It can occur in the frontal, in the temporal, in the vertex region. It can occur in the occipital region. It can occur in the parietal region. It can occur anywhere in the head, and it can have different forms. It can be throbbing. It can be pulsating. It can be drawing. It can be radiating pain from the neck, or it can be an extension pain from the shoulder, from the neck to your occipital region. And it has thousands of causes for headaches, right? It can be cysticercosis, where there is tinea infestation. It can be high blood pressure. It can be tumors in the head. It can be gastric headaches. It can be ear related. It can be dental related. It can be bone related. It can be mandibular process related. There can be tension in the muscles that is causing the pain which is radiating from these muscles to your zygomatic, from the zygomatic area to your temporal area. It can be because of too much of screen time. It can be cluster, tension, migraine. There are hundreds of headache reasons, right? But if it is because of hypertension, you will be experiencing pain in the occipital region, that is the back of the head region. Many people especially will be experiencing pain in the occipital region. It is usually throbbing or pulsating kind of pain, and some people will also have neck extension where they will feel uneasiness in the neck without any visible causes or visible deformities in the x-ray of the cervical spine, right? Next thing is nosebleeds, which is very uncommon. It only occurs in people where the HTN is not monitored properly or HTN is not controlled properly. There is an area called as Little's area in the nose, where there is severe blood pressure that can break out and cause nose bleeding. And then there is shortness of breath, which is a common feature. Then there is vision problems, which is more uncommon, like the nosebleeds. If the hypertension is not monitored properly, or there is too much of high BP, then you will be having a blurred vision suddenly, and then the vision will clear out, and then you can have bouts of this blurred vision problem. If you are having something like that, do consult a doctor as soon as possible, because it can be because of BP, it can be because of even tumors also. And then chest pain, unmonitored hypertension plus obesity will lead into chest pain or cardiac symptoms or heart related symptoms. And then dizziness is another cause, because there is too much of blood pressure rising in the body, which can give you a faint feeling or dizziness feeling. And then we have other signs and symptoms: unmonitored, improper management of HTN along with obesity and along with improper lifestyle and sleep cycle can give rise to irregular heartbeat, which can be a cardiac symptom. And then we have fatigue, which is common. We have confusion, which is almost common in everybody these days, with or without hypertension. But though, if you are having blurred vision, if you are having ringing sounds, if you are having some sort of problem perceiving the thing, or if you are having too much of stress, sometimes it can lead into confusion. And then we have nausea and vomitings. If the headaches, which are in the starting stages of hypertension, are not monitored properly, it can lead into nausea and vomiting. And then we have anxiety. Almost everybody is feeling it these days. And we have flushed face. What do you mean by flushed face? It is rush of blood to the head and to the facial region whenever you are angry, or whenever you see someone you like. That is called as blushing. Though whenever you are angry, or even without getting angry also, your face looks a little flushed. That is as if you have put on some blush. Even some people experience redness in the ears also, the nose area, the zygomatics area, or the cheek area also. See, with this sign is almost difficult to spot in people who are darker in complexion, because it's dark. It is not easy to spot the flushness. But people who are fairer in complexion, this can be noted easily. But that is not the main sign of hypertension. It can be because of various reasons also. Now we will see how PCOS will affect or cause this HTN, and how it will maintain the HTN. By HTN, I mean hypertension. So let's dive into the topic to know more. I'll explain it to you on very simple basis and very simple terms, so that you don't have to get confused. And you can share this video with people who are suffering with PCOS and hypertension. See, PCOS comes with tags, which is basically, it has polycystic ovaries, it has irregular periods, and excess androgen. That is important. It also comes with obesity, and it also comes with insulin problems, which is hyperinsulinemia and insulin resistance, right? What happens actually in PCOS? Whenever the heart is pumping blood to the arteries have two things. Arteries are nothing but tubes, right? Arteries can dilate and they can constrict or constrict, as we can say, depending upon the situation. For example, whenever you're seeing a tiger, you have to run, hence you have constriction of the arteries to increase blood pressure, right? So, if the artery is constricted, what is happening? Blood pressure is increasing, right? So, if the tube is small and the amount of water should go out is more, what will happen? The pressure will be more, right? So, if it is relaxed, the pressure will decrease, right? So, in PCOS, what is happening? There is insulin resistance and hyperinsulinemia and excess androgen, right? These three together will cause this artery to be constricted always. It's like always constricted, always on angry mode. So, it's always very diameter of the tube is constricted, it's restrained, okay? So, the blood pressure is always high. Apart from that, there is another thing. This insulin resistance and hyperinsulinemia, they have this attachment with sodium. So what they do, they tell the kidney to reabsorb the sodium. Whenever the kidney is filtering, excess sodium is washed off. But what they do is, they will have an attachment issue with the sodium. So they tell the kidney to attach or reabsorb the sodium from the excretion. So sodium is reabsorbed by the kidneys. What happens when sodium is reabsorbed? Sodium has attachment issues with the water. So what is happening? Sodium is coming along with water and H2O inside your body. So what is happening? Water retention is happening. What else is happening? You will be getting puffy face, you will be having edematous hands, legs and everything, and carry bags also. But apart from that, what is important? The blood volume is rising. Why? Because there is reabsorption of sodium, along with sodium comes water, blood volume is raising. So whenever there is blood volume raising and there is constriction of arteries continuously, what will happen? BP will rise continuously. That is how in PCOS you will be getting hypertension or high BP, and that is how it is managing or it is maintaining. Unless and until you clear out the insulin resistance, hyperinsulinemia and excess androgen, you will not be able to control the hypertension just by using. Of course, by taking BP allopathic medications, you will be able to control it. But if you stop it, what will happen? Again, this will reoccur. So, in order, if the hypertension is of PCOS nature, you have to control it by controlling these three, which is hyperinsulinemia, insulin resistance, and excess androgen. Now we have the conventional form of treatment or the allopathic form of treatment. How do they treat, or what medications will they be giving you if you're suffering from PCOS and you have an hypertensive origin from PCOS, right? So remember, PCOS directly does not cause hypertension on a very short period of time. It causes hypertension on a longer run. Okay, by the time it's running like this, it will not only cause hypertension, it will cause even sugar also. That is type 2 diabetes, sugar, which is commonly called like I have sugar, which means you are diabetic in nature, right? So it will be causing all of this. It will be causing obesity, and then it can lead into hypertension, and this hypertension can lead into cardiac problems. So what do they give you? They give you ACE inhibitors, and they will be giving you oral contraceptives, they'll be giving you anti-androgens, they'll be giving ovulation inducers. So what is the problem with all of these? This, as soon as you stop using it, your BP will again fluctuate. As you're using this oral contraceptives, if you're planning for pregnancy, you cannot get a baby because it is a contraception method. And then apart from that, you will be having weight gain, you will be having hair fall, you will be having acne, you will be having skin issues. And then apart from that, if you're stopping this medicine sometime by mistake, you've forgotten the pills somewhere, you will be experiencing mid-menstrual bleeding. And after using this for even years together, if you stop it again, you can experience PCOS symptoms or revert backing of the hormonal problem or the imbalance. And then we have anti-androgen medicines. As soon as you're using it, the androgen level can start to come down, and then you're stopping it, and again it will start. So that is the problem. And then coming to the ovulation inducers. So what happens in ovulation inducers? It will help you in giving or helps in releasing the egg, right? So by releasing the egg, what is happening? The egg is being released, and if you stop using this ovulation inducers, the egg release will be stopped, because PCOS is equal to an ovulatory cycles. Okay, and after giving ovulation inducers, we do not know the quality of the egg. Okay, we do not know what quality of the egg is being released, and if it can be retained by the uterine endometrium, because that is the problem with the uterine endometrium, is that in PCOS it is abnormally developed. Okay, so if you are stopping this ovulation inducers, then you will have what? You will not be having any sort of egg releasing. So you need a medication which will help you in controlling the BP, which will help you in increasing the fertility without contraception, which will help you in decreasing the androgen medications, which will help you in decreasing the androgen levels, and then help you with the fertility issue. We have a system of medicine which acts on all of these, and balances out all of these, which is nothing but homeopathic form of medication. The homeopathic form of medication, here we understand the link. So what is the link that is causing this BP to act? Say for example, there are 100 people who are suffering from PCOS from 10 years, or from 5 years, let's suppose say, or from 8 years. Not everyone will be developing hypertension. Not everyone will be developing your type 2 diabetes. Not everyone will be developing obesity. Not everyone will be developing hirsutism, or the excess hair that you are growing on the face. Different people will develop different sets of diseases. You need to understand the genetical link. The father, the mother, the grandmother, the grandparents have to be studied. The link should be studied. The stress process should be studied. What is the form of stress that is there? You should have to study. Even if it is not there, if it is genetic in nature, you have to study the tree and then understand the link. Even if 3 people from the same family are suffering with the same set of symptoms, the homeopathic medication will differ for each and every person. It is tailor made and it is customized just for your needs, so that we will be able to balance out your hormones, balance the menstrual regulation or regulate your menstrual cycle, and then improve the fertility, decrease the androgen level, and give you better health and better life. It will be able to relieve the symptoms, cure the current condition, and prevent the further recurrences. We have understood how homeopathy is the best choice for lifestyle disorders, right? Here, Fidicus homeopathy is the best option in homeopathic field. So here we have 2 kinds of consultation options. So one is the online consultation. The second one is the offline or the in-person consultation option. In person, if you're staying nearby the nearest branch of Fidicus, you can come and contact us. And then if you're staying far away from us, you can contact us online, either through audio consultation option or through the video consultation option. And after the doctor consultation, after your investigations are verified, especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days. Staying in USA, 3 to 5 business days. Apart from that, across the globe, anywhere, 4 to 8 business days for our medicines to reach your doorstep. If you want to get in touch with us, you can call us on this number, WhatsApp us, or message us on this number. And if you'd like to know more about Fidicus homeopathy, you can check our website www.fidicus.com. We have understood how homeopathy is the best choice for lifestyle disorders, right? And why should you be choosing Fidicus homeopathy? Because Fidicus homeopathy stands for highest chance of health. Here we follow three principles. First, we are experiencing high success rate in cases where there are endometriosis, where there is adenomyosis, where there is PCOD, PCOS, where there is bulky uterus, fibroids, Nebotian cyst, Bartholian cyst. We have other kind of female cervical erosion. All of these cases have high success rate. Second thing, the transparent treatment. There is no gray area between the patient and the doctor. The treatment option as well as your prognosis will be clearly explained to you. Third thing is the personal care, which is top notch at Fidicus. Any sort of queries, any sort of doubts that you are having, you can express it to us and we will be answering and busting all of your myths and queries. So if you want to choose cure, if you want to choose health, choose Fidicus homeopathy. So today in this topic we have learned how PCOS can cause hypertension, how it can maintain hypertension, what are the hormonal changes in PCOS that can cause this hypertension, and what is the symptomatology cascade of this hypertension, and what are the best treatment options, right? So if you want to know more about PCOS, or if you want to know any other topics in female reproductive health, you can go to the comment section and drop your comment there. We will be replying it to you. And if we have many comments regarding a certain subject or regarding a certain topic, we would like to do a topic on that as well. So see you all in the next topic. Thank you.
Fidicus Homeopathy.